Hello, my name is Molly Schroeder, and this is my proposal presentation for my work titled Next Generation NCLEX Impacts on Nursing Education. To start, a little bit about me and my professional career has incorporated a little bit of research. While living in New Hampshire, I was a co-researcher in a study at the VA hospital that analyzed readmission rates of patients with congestive heart failure. In analyzing this data, future studies were able to be conducted at this institution, which helped identify how doctors and nurses can impact readmission rates and changes to practice that may be necessary. I obtained my nursing license in 2019, and since then have been working in medical, surgical, and oncology units where I obtained my chemotherapy and biotherapy certification to care for patients undergoing cancer treatment. On top of caring for patients, I precepted new graduate nurses and nursing students in their clinical experiences. In doing this, I found my passion for teaching and helping students chase their goals. Both on the inpatient and outpatient side of nursing, I gained valuable experiences working as a team, utilizing evidence-based practices, and asking questions to improve nursing practices. During this time, I worked towards my Master's of Nursing in Nursing Education, of which I graduated in 2022 from the University of Southern Maine. My plans for my career entail teaching nursing at the collegiate level and specifically in the clinical and laboratory settings, as I feel that students learn best by practicing and doing skills and being tested in a real life setting. My higher education journey started at Colby Sawyer College, where I obtained my Bachelor's of Science of Nursing in 2019 and began practicing as a registered nurse. I then moved on to study for my Master's of Nursing in Nursing Education at the University of Southern Maine, graduating in 2022. During that time, I was taking travel assignments and traveling down the East Coast to many different hospitals. Come 2023, I was ready to start another journey with the University of New England to seek a doctorate in education. With my background in nursing, my goal for my studies at the University of New England was to examine how nursing curricula can be improved to incorporate more critical thinking activities and other valuable changes to increase the pass rate of nurses sitting for their licensure exam. With the most recent changes to the NCLEX, students' critical thinking capabilities are tested at an all-time high level, demanding a change in nursing education and the preparation of students for practice and licensure. My problem statement is listed on the slide. It states there is a present disparity in education as a result of the recent 2023 change to the NCLEX format, with increased complexity in which nursing programs are tasked with improving their nursing education curriculum to prepare students to sit for nursing licensure. The purpose of the study was to propose changes to student nurse education and licensure preparation as compared to current preparation materials in order to increase student likelihood of passing and the ability to produce competent entry-level nurses. My research question and some sub-questions that I have formulated over this time have been: how can we as educators improve nursing curricula to account for the updated expectations of the next generation NCLEX? And furthermore, how will educator training shift? What changes to the exam do educators need to be aware of? And how does this reinvented exam change expectations for students moving forward? My literature review yielded some themes that aid in my research, such as ideas that the utilization of the clinical judgment model has proven to positively influence student performance on the NCLEX. Furthermore, nursing education needs to incorporate more critical thinking activities and focus on evidence-based practice in the clinical settings. Student reflection and feedback allows us to improve education over time, and NCLEX pass rates allows us to identify a need for curriculum changes. And finally, another point, future next generation NCLEX data will allow educators to assess if implementations of increased critical thinking activities were successful or if more change to nursing education is needed. My literature matrix can be viewed using the following link at the bottom of the slide. The challenges that I identified in this project are as such. The next generation NCLEX is a new exam. There is limited students that have taken the new NCLEX, limited studies regarding a change to nursing education due to examination update, varying curricula formats, concept-based curriculum versus competency-based curriculums, the time release of next NCLEX data to the public, which is delayed and can be within like a year of a cohort taking the exam. Finally, my next steps in this dissertation process include analyzing research, compiling ideas, and formulating a plan to conduct research and move forward. These are my references. Thank you for listening to this presentation, and I hope you have a good day.